Hello, my name is Hannah Zuercher, and I'm a second-year internal medicine resident at the University of Florida. Picture this. You're going in for your annual doctor's visit, and everything seems okay, except your doctor tells you that you are overweight. Your uncle, who is also overweight, was recently diagnosed with fatty liver disease, and you're wondering if you could also have fatty liver disease. Let's dive into this topic. First of all, what is fatty liver? Fatty liver is a condition where too much fat builds up in the liver. Is this the same thing as MASLD and MASH? MASLD stands for metabolic dysfunction associated steatotic liver disease, while MASH stands for metabolic dysfunction associated steatohepatitis. These are essentially the same thing as having a fatty liver. MASLD is having a fatty liver, while MASH is also having a fatty liver, but with inflammation and scarring. How does having too much weight cause a fatty liver? So having too much weight causes a fatty liver because there is an excess amount of calories. This can be from cookies, donuts, pies, pretty much any food, but it can also be from healthy foods too. It's just having too many calories. Therefore, there's too much fat in the body. Then, the fat builds up specifically in the liver. The liver has an important job of removing toxins from the body, but it can also store too much fat. Too much fat causes liver irritation, swelling, and damage. So then, the liver can become inflamed. After that, scar tissue, also called fibrosis, may form. This scar tissue replaces the healthy liver cells, making it harder for them to function. And then lastly, the liver can become stiff and stop working. This is when severe scarring, also known as cirrhosis, occurs. Remember that liver has a very important function in the body to remove toxins, and it can no longer do so. So back to our topic at hand. I'm overweight. Do I automatically have fatty liver disease? No, not necessarily. Being overweight does increase your risk of having fatty liver disease, but does not mean you definitively have it. Why is this? Some people store more fat in their liver than others, even at the exact same weight. I'm very worried. What should I do? You should go see your doctor. They may run blood tests such as liver enzyme tests, tests for diabetes, and tests for your cholesterol. They may also do some imaging called fibroscans, which is a specialized ultrasound, CAT scans, or MRI scans may occur. I know that fatty liver disease may seem scary. However, if this is caught early, we can reduce the risk factors that cause fatty liver disease and then decrease your chances of that fatty liver becoming inflamed and scarred, also decreasing your chances of cirrhosis or end-stage liver disease.